Now, South Asian and Black people's risk is 2 to 4 times that of our white um, neighbors. And essentially, we've seen that again in COVID, that, Black and South Asian people, or we call it the BAME group, um, are more severely affected by those, with COVID-19. But it's also true of diabetes. And we spend as a country 10 billion a year, and it's rising. So it's something we really need to get a handle on. But it's not new. It's not new. It's been known from the Egyptians in 1550, written in their papyrus, the Ebers papyrus, the manuscript there, and also in India in 600 BC. The diagnosis used to be, if you pass urine on the ground, if it attracted ants because it was sweet, then you had the diabetes condition. Now, where does all this glucose come from? Where does it come from? Well, it comes from our food, and it also comes from our liver. So if we're eating, and we tend to eat 2 to 3 meals a day, it may be hidden sugars. It's well known that sugars are hidden in fruit juices now. There might be added sugars to the cereal. The dressings on salads may be quite high. Even healthy snacks like the 0% fat, they might, cover up the loss of fat by making it sweeter. And then the breakfast bars. So it's in our food. So we really need to be, aware of that and make the right food choices. So how does our body manage glucose once it gets into the system? Well, hiding behind the stomach, there is an organ. It's called the pancreas. If we keep removing the organs, that will reveal the pancreas has a head, a body, and a tail. Going further in, we can see the architecture in the pancreas, and we can see that these light circular patches, almost like islands. So the word that is used to describe these are islets, which means islands in English. So islands of the person who discovered them, Langerhans. It's called Island of Langerhans. And it's within these cells, these islands of Langerhans highlighted here, that you have these cells called the beta cells. And they're also alpha and delta cells, but the beta cells produce our insulin. So how does it know when to release insulin, the pancreas? Well, glucose from the food that we've eaten directly enters into those cells, and it kicks off a triggered pathway, a series of steps that ultimately result in insulin being released. But if you can see the two arrows at the top, there's the arrow next to glucose and the arrow next to insulin. We are so, I believe, designed that glucose and insulin, the body matches it perfectly. So this is when everything is going well. Now, once the insulin is released, it then goes to cells in the body. It could be our muscle cells, it could be fat cells, it could be other tissues that needs to get the glucose inside of it. And first, the insulin, acting like a key, will sit in the receptor, the image on the right. And as it sits, it then allows the port to be opened to allow the glucose to enter. There are a series of reactions in the cell that essentially recruit someone to go and open the door and open the channel. So there's several communications going on there. But ultimately, once insulin gets into that spot, the door is opened to allow glucose to enter. Now, what goes wrong in diabetes? Um, Hopefully, looking at what happens in normality can give us some ideas on or better understanding about what goes wrong when we consider the three main types of diabetes. There's type 1 diabetes, type 2 diabetes, and gestational diabetes. Now, there are other diabetes out there as well, whereas genetically, we call it monogenetic diabetes, but it's a much smaller population. So, for instance, 85% of all diabetics are type 2, 10% are type 1, um, and the other 5% is divided mainly between the gestational and the other ones that we will not cover any further in this talk. So, in type 1 diabetes, um, what happens is that the body essentially attacks itself. It's the final common pathway. So there are many triggers. It may be environmental. You know, some people think casein and cow's milk, or a virus. You know, if you get an infection as a child, sometimes the viruses can trigger this off. But you would have had a genetic component to it. You may have had a sibling. You know, they've done studies in twins and found that 50% of twins both have, you know, type 1, suggesting that there's a genetic component. But however, sometimes when those twins are separated, even though the genetics have been shared, one might develop type 1 diabetes and the other might not, suggesting that there's a role for the environment also to play. So we've got a genetic predisposition, we've got environment, we've got viruses, we've got potentially casein, and there's a argument about, you know, clean homes not allowing kids to be exposed to any bugs so the immune system can learn what is self and what is foreign. But whatever it is, once it triggers off the attack, the body attacks the beta cells that we saw in the pancreas and destroys their ability to make insulin. Now, years ago, this would have been, you know, a sure, unfortunately, a death sentence because insulin is required for life. It's you know, it's one of these things that we need in our bodies to live. So before insulin was discovered, this would have been a certain death sentence. But with technology discoveries and even matching insulin to the human insulin, we know that there are many people now who live normal lives with type 1 diabetes. So how would we know if we had type 1 diabetes? Well, there's a campaign going on in the NHS, and it's called the 4Ts campaign, and it you know, it highlights the symptoms of type 1 diabetes. So we talked about the toilet. So what happens is, if you've got sugar in the blood, okay, the sugar itself attracts water. Where does it attract water from? Well, it pulls water from the cells. When it pulls water from the cells, that's a lot of water coming into the bloodstream. And as the bloodstream is passing through to be filtered by the kidneys, then it would push a lot of it into the urine, both water and sugar. So you find that you have to go to the toilet a lot. But because you've taken that water from the cells, your cells are now dry and you would sense that in thirst. So you had this unquenchable thirst, always wanting to drink water and then always then using the toilet as well. But sugar is energy. As I said, insulin is essential for life because it opens the doors to the cells to allow glucose to get in, to allow us to have energy. So if the sugar is not getting in, um, you know, then we would feel tired, fatigued. And so we get that as one of the symptoms as well. And lastly, if your body is not getting sugar, if we think sugar for the body is can be seen as food, then the body itself, you know, the body itself would think that it's in starvation mode. So first, the body would call upon the fat stores, and then it will call upon the muscles. And therefore, people can actually lose a significant amount of weight. And that's why you see the person going thinner as one of the other signs. So, toilet, thirsty, tired, thinner. If you have these signs, pardon me, you should think about getting checked out for diabetes. And we'll go into that later. Now, type 2 diabetes, the causes. So, in our modern society, I think the two main causes, the fact that we eat the wrong foods, and eating the right foods is challenging. Let's be honest. If you're in a deprived area and you can't afford it, some people think that healthy foods are expensive and sugary foods are cheaper to get, and so they may opt to have high sugary content foods. There's also the abundance of foods, and so we get excessive amounts, and we can then put weight on, experience obesity. But going with the overeating or the high sugary content foods is inactivity. So our diet and our activity are crucial to the causing of diabetes. Many of us and many of our patients that we see, I do obesity clinic, I do cholesterol clinic, and diabetes either manifests in them or causes them. And so, you know, getting patients to change their life is a key strategy. More exercise, less food, less food. Now, other things would be genetic predisposition. So, if your parents, and I'm in that position, both have diabetes, then you are at a significant risk of developing diabetes in the future. So, knowing that, you need to take steps to prevent diabetes from happening. Stress. We don't think about it, but one of the hormones that helps us manage stress is cortisol. And cortisol is what we call an anti-insulin hormone. It pushes up your sugars. And therefore, again, high sugars can actually lead to type 2 diabetes through stress. Stress can cause that. We've got medications that may be similar to that hormone cortisol called steroids. Steroids can cause diabetes. And there are other medications as well that may cause diabetes. Today I was in a meeting and we were talking about the small risk of the cholesterol lowering medication called statins that can actually lead to diabetes. So it's now recognized that statin can increase the risk of diabetes in a small group of patients. You also have age. The older we get, we may be losing the number of beta cells in the pancreas. And as they die off one by one slowly, as we get older, we may get to a critical tip over point where we develop type 2 diabetes. Um, Diseases that directly affect the pancreas and high blood pressure are also mentioned on this slide. So there are many potential causes, but the key one I want to focus in on would be diet and inactivity, um, and diet to the excess or the wrong foods and inactivity. Those are key ones. And let's face it, with COVID-19, stress is also a very real threat as well. So how would you know if you have type 2 diabetes? Well, it's mainly looking at your life and saying, am I overweight? How much activity do I have? Do I have a family history? And if the answer to those are yes, then the advice would be to get, an appointment with your GP and get tested. And again, we'll go into the test shortly. Lastly, diabetes and pregnancy. So um, one of the problems with obesity is, and how obesity causes, and that's weight around the tummy, causes diabetes, is because of a phenomenon we call insulin resistance. And we find the same phenomenon in pregnancy. The hormones that are necessary for your baby to grow and develop, they actually are insulin resistant hormones. They cause your blood sugars to be high. And that could be there because, sugar is energy. You've got a baby growing, the baby requires energy. So it's pushed in the direction of the baby to help the baby to develop and grow. But actually, by keeping the sugars for the baby, then it's causing insulin resistance in pregnancy. So many women who may have been pre-diabetic before pregnancy may become diabetic in pregnancy. Those who have been normal may become pre-diabetic in pregnancy. And it's called gestational diabetes or diabetes in pregnancy. And even after the baby has been delivered and the blood sugars come back down, it has a legacy that you can potentially develop type 2 diabetes in the future. So that would signal that you're at high risk of developing diabetes in the future if you've had gestational diabetes. And how would you go about approaching that? How would you go about checking that? Well, again, you'll be under your doctor, your obstetrician. They would do all the checks. They will check you for your sugars at the right stages and monitor your blood pressure. And that's usually how it's diagnosed. Um, and speaking about diagnosis, in pregnancy, we normally use the one in the second one down from the left called OGTT, where someone drinks your blood is taken after fasting, let's say overnight and not having breakfast. Your blood will be taken. Then you'll be given a sugary drink of a certain amount, is 75 grams of sugar. And then 2 hours later, your blood sugar level is tested again, and that's the OGTT. Um, the first one, fasting plasma glucose, is simply not eating after 8 o'clock, not eating breakfast, going to your GP, and having your blood test taken. So that's fasting plasma glucose. The third one on the left is your HbA1c. Now, your HbA1c is your measure of your glucose control over the past 2 to 3 months, let's say 90 days, okay? And essentially, as the red blood cells are traveling through the vessels, it is picking up sugar. And we can then measure the sugar in a standardized way to see if you're diabetic or not. And then the last one is if you present with these symptoms. Remember we said about thirst, going to the toilet, weight loss, and very tired. If you present with all of those symptoms, we can just do a blood test. And if your sugars are above 11.1, then that's a diagnosis for diabetes as well. So here we can see normal, pre-diabetes, and diabetes. So going back over that again, if you're just fasting, if your sugars are above 7 on the right in the red zone, you'll be diabetic. The oral glucose tolerance test, if your sugars after the 2 hours is above 11.1 second line, you'll be diabetic. The HbA1c, if your sugars are above 47 and above, so say 48 is where we usually say, if you're 48 and above, again, that would signal diabetes. And if you have symptoms and you present and your blood test is taken, if that's above 11.1, again, that would be a diagnosis of diabetes. So the advice would be to get checked by your GP. Have this HbA1c to see how your sugar is controlled over the last 3 months, or have this fasting plasma glucose test to see where you are. Now, the harm of poor diabetes control is it's both the small vessels of the body and the large vessels of the body. If we start with the small vessels of the body first, it can damage the eye, it can damage the kidneys, and it can damage the nerves. And the large vessels, it can damage those in the heart, the brain, or even in the feet. And this will be demonstrated in the brain by stroke, heart by heart attacks, and that's usually a very high cause of death in patients with diabetes. They might die of a heart attack. Um, in the feet, you'll get diabetic foot disease, which can lead to amputation. The kidneys and microvascular, it can lead to your kidney damage and cause, persons to end up on dialysis or needing a transplant. And with, the eyes, it can cause diabetic retinopathy, glaucoma, cataract. And lastly, the nerves, people get from their fingertips all the way up. We call it ascending peripheral neuropathy. or glove and stocking, both in their toes going up their legs and the fingers going up their arms, glove and stocking. So how does that look? Well, the picture on the left is what we would see normally, and the picture on the right is what someone with diabetic retinopathy may view that same picture, and that's shocking, that's stark, and that's how their vision, would remain, and that's a serious consequence. And this is microvascular disease. Now, the foot is also very shocking. um, Persons can lose toes, they can have their feet amputated. Even the shape of the foot can be altered. If you look at the left foot, the shape of the foot is completely altered. And here you have diabetic ulcers, because in diabetes, if you've got that nerve damage, you can't tell if you're standing on a stone or not. And it could lead to, infections and subsequent amputations, even of the whole foot. Now, I mentioned this already. Take the test. HbA1c, take the test. Now, we're now going to go into prevention. So now we know how diabetes is caused. Now we know the symptoms. Now we know the potential effect it can have on the body. Now, what can we do to actually prevent ourselves from getting diabetes? Now, in type 1 diabetes, this is quite a new concept. Normally, people thought that once you got it, that's it. But now there's studies, even as we speak, looking at ways to classify persons who are high risk to see if they would benefit from early anti-immune therapy to suppress the immune system, to stop it attacking the pancreas, to try to preserve those beta cells and therefore prevent any um, ultimate total loss of your insulin production cells, and therefore prevent someone becoming type 1. There are also studies looking at weight loss in the group, because they've noted that, children, and this again usually happens in children, usually below the age of 25, and it can start very young, 3, 4, all the way up. That there's a potential correlation between weight and development of type 1. So they're looking at programs to see if that would actually reduce the rates of type 1. In type 2, we talked about the two most important ones, which was inactivity and diet. But obviously, a poor diet and inactivity leads to weight gain, which was also one, and poor sleep was also another. So to reverse this, we need to do these things daily. Sometimes we know about things, but actually we don't know until we do. It's in the doing we get the knowing, and it's in the knowing and the doing we get the true benefit. So, if anything we take away today is that yes, we know what to do. It's just about doing it every day, day in, day out, consistently. And I'm speaking to myself as well. So the lady on the left, she's obviously walking slash jogging, and exercise in the open, fresh air with sunlight. Drinking water is always the best way to go. And this is the type of exercise we would advise: minimum 30 minutes a day, ideally an hour a day. And if you can't do an hour in one go, you might want to break that up into two half an hour times, or 20-minute, 3 20-minute slots, however you want to do it. But the minimum is half an hour, which means 150 minutes for a week. But we can easily exceed that. But the advice would be 1 hour a day. Looking at the fiber, we know that the problem with sugar is that it goes into the body quickly, the bloodstream quickly, and then the beta cells have to work really hard to produce the insulin. Remember, to match that glucose arrow. So if we can eat foods that actually make the job of the pancreas easier, very slow release foods of sugar. This happens with high fiber foods, and this is mainly, things like legume beans, pulses, um, you know, um, things like celery or broccoli, lettuce. These things have high fiber in them. And, fruit like apples, pears, as you can see in the picture, the sugar release will be very slow and steady, and therefore you don't get these spikes or these drops, which we've now realized high insulin is bad, high sugars are also bad, and then low sugars are also bad. So if you keep it nice and steady, that will be beneficial to the body. This chap is a DJ, I understand, and he's done really well to lose weight. And that's one way you go about preventing type 2 diabetes and getting your good night's sleep. Now, sleep between 9 to 10, we know your melatonin is at its highest, and that 7 to 9 hours from there gets you the more restorative sleep, which means your levels of stress hormones in the morning are lower, cortisol, and therefore we know that high stress hormones can lead to diabetes. So if we get a good night's sleep and we switch off, those stress hormones, that is beneficial to the body. Um, Obviously, we need stress hormones to wake up and get through the day, but what I'm talking about is an excessive release of those hormones. Also, we know that those who lack sleep tend to pick high sugar foods for energy to get through the day. So also that would avoid that as well. So let's speed up a bit. This slide is about reversal. Now, 5 years ago, even um, when you talked about reversing diabetes, um, persons would have laughed you out of the medical arena. But this study's come out in 2017, and essentially it was done in a GP practices in Scotland, and it's called primary care led weight management remission of type 2 diabetes. And essentially, what they did was to go through the records in the GP practice, get patients who were type 2 diabetes but not on insulin, maybe just one or two medications orally or so, and try to reverse their diabetes. Now, they gave them a diet which was reducing their intake of calories. So for men, it said 2,500 calories. For women, um, 2,000 calories. These persons were put on an 800 calorie restrictive diet. And it wasn't even just a diet, it was complete meal replacement, potentially in liquids. So they'll have 3 sachets a day, and roughly it was about 800 calories. And they did this drinking these 3 sachets a day, no food, for 4 to 5 months. And then they reintroduced foods after that very slowly, and then they gave information on how to maintain weight for the rest of the 12 months. So, what did that study find? It found that, and this is what I just described in terms of the trial, that within the first 20 weeks, the weight significantly dropped off. And then once food was reintroduced, if it was done properly, in 50% of people, it was maintained. And so those people who had, I think it was 48% of people who managed to keep the weight off, maintain that weight loss, they completely reversed their diabetes. And now there's a program being rolled out in the NHS called the Diabetes Reversal Program. So it's open to anyone who's got diabetes, newly diagnosed within the last 6 years, preferentially not on insulin, but again, ask your GPs about it or spread the word. And there's a reversal diabetes program, but you would have to commit to that 4 to 5 month liquid replacement diet with no food. Um, and I'm sure that's tough coming up with holidays and everything, but it proves the concept. If we can restrict the calories, lose the weight, we can reverse the diabetes. So weight loss is crucial to reversing diabetes. So what if you already have diabetes? Now this looks like the picture we saw earlier, only changing the food picture, because that's the key. The key, even if you've got diabetes, is to live a healthy lifestyle. exercise in the fresh air, lose the weight, eat the high fiber foods. And if you have a look at that picture with the high fiber foods, you can realize that it's very, very colorful. Now, we know that colors are and natural colors are very much more beneficial than brown or white. Brown or white, brown bread, white bread, brown chips, brown potatoes, or white potatoes, white rice, all of these things. If you're reaching for white and brown, you know, think it's not colorful. Is it actually good for me? And just stopping and thinking, oh, this is a brown or white product, you know, what should I do? It helps you potentially at that point to choose a healthier option. So colors are good, white and brown, avoid. So, achieving good control in diabetes, by living the healthy lifestyle, by taking your medication as prescribed, even discussing with your GP if you lose the weight, if your sugars come down, can you reduce your medication? All of these are benefits. And this study, called the DCCT trial on the left, showed that in two groups, one just did the normal thing, and the yellow group did an intensive treatment. After that intensive period was relaxed and the groups came back together in terms of lifestyle and even blood sugar measurements, what happened? Well, look at the graph at the bottom left, and you can see that the blue line is higher than the yellow line, and that line is talking about events. So, heart attacks, strokes, or death, CVD death was higher in the blue group than in the yellow group. So what does that mean? That period in the top graph on the left, on the far left side, the yellow group, that period of very good control meant that even though they went back to not so good control later on, it still had a health benefit on their survival. And it's called the metabolic memory. And some believe that this changes your epigenetics and helps your body to resist things like atheroma and other things. So good control has a legacy. Good control keeps you and protects you from having harmful events. And on the right, we see that in the UK PDS study, it was looking at the legacy effect, very similar. The intensive group again in yellow, the conventional group again in blue. You find that over the study, the intensive group, and that's over several years, had a lower blood sugar, but when the intervention finished, the blood sugars came together between those two dotted lines, and what then was the impact of them coming together? Did it mean that they had the same event rate? No. The chart on the far right, we can see that the yellow bars are going further down, um, as it meaning protecting, those from microvascular disease. So the eye disease that we saw, the nerve damage that we saw, this group, when you're controlled tightly, protects you against that. So good control results in a protective effect. So just to summarize, as we're coming on to the end, um, if you think that you're high risk, meaning there's diabetes in the family, you're carrying a bit of extra weight around the middle, you've got a high stress job or a high stress lifestyle, you're not managing to sleep well or eat well or even exercise daily, then, and you're concerned about diabetes, the advice would always be to get checked by the GP. Now, these habits that we need to involve in our lives to protect us, because as it says on the right, health is wealth, these habits need to be done daily. We need to get eating in the right way, choosing the right foods, high fiber foods, slow release glucose foods, low glycemic index foods, these high fiber foods. And again, naturally, they're in colors, both fruits and vegetables. If that's our main fear, then, it serves us in good stead. And the king prince pauper principle is suggestive of a very hearty breakfast and, you know, a supportive meal in the middle of the day. You know, you could take that to mean, you know, anywhere between 1 and 4 p.m. And then potentially, if you're carrying weight around the middle, not eating after that, you know, or if you're hungry, having a light, you know, you may have an apple or, you know, an orange, and let that be that, or a light soup in the evening. So it's completely flipping how we would normally eat and live in life. Get moving, get moving, get moving. We've seen that exercise is essentially like insulin. It actually gets the sugars into the muscles for energy and therefore reduces your sugar level. But it also reduces your fat, and fat cells can actually lead to insulin resistance, which then could cause diabetes. So, you know, there's so much benefits to exercise, but for this evening's presentation, it's about preventing diabetes. Sleep between 9 and 10 to get the benefit of that melatonin release. Sleeping through to the morning, again, that restorative, restful sleep results in less stress, lower cortisol levels, and protects against poor food choices and therefore unintentionally going into the diabetic zone. And lastly, again, a healthy weight. So um, I will end the presentation here. Hopefully, that's not um, too quickly, and I'm happy to open up for discussion and questions, and potentially even speaking more on any areas of the presentation that you may request that I go into further detail with. So thank you very much.
Okay, thank you very, very much for that very interesting, very full presentation. We have had a couple of questions I have seen in the chat, Kevin. So we will proceed through. Could you just stop sharing, Kevin? Would that be all right? And I think
Yeah, that's fine.
yeah, you just
Yeah, brilliant.
read that's a little bit easier. So, again, thank you, Kevin, for taking your time. Very busy man. So we really do thank you for taking the time and sharing that information. Coming on through then, I believe, let's just have a quick look through the questions. We had one, bear with me, which was, would stem cell transplants work and how? So stem cell transplant, would that work and how does it work?
So it's a very good question. So if we go back to type 1, okay, we talked about the total destruction of the beta cell or the insulin producing cell. Stem cells are pluripotent, meaning that if you give them the right conditions, they can change into any cell that you would want them to be. And therefore, if you can somehow grow your stem cells to become these insulin producing cells or beta, you know, beta cells or the Langerhans cells, and actually implant them into the body, then potentially they can take over the insulin production and therefore act like a, you know, a, a renewed pancreas or a transplanted pancreas, but it wouldn't be the pancreas in itself. It would be the insulin producing cells transplanted from the stem cells into the body. And where would you put them? You know, I think, well, first of all, I'm not a surgeon and I'm not in that area of research, but that concept is one that I'm sure is being tested. And you know, you may think about implanting it into the liver, because the liver has the first pass of anything coming from the gut. So that would be an interesting, you know, a choice place to put it, because you get everything coming from the gut. Everything that you eat passes through the liver. Your liver is your major detoxifying center. It has a very good blood supply both in and out of the liver. So placing these stem cells that have been converted to beta cell Langerhans in the liver potentially would be a good site. So it's proof of concept. Yes, I'm sure it's happening, and yes, it's possible.
Okay, but still possibly a little bit way away then from what you suggested.
Yeah, so I am not up on that side of the research. So I'm not sure how far away. But yes, I'm sure it's being investigated.
Excellent. Okay, thank you. Another question is, what if your blood sugars are erratic, either extremely high or low? And Mary Kay is asking what can be done to stop this fluctuation of high and low.
So, that crucial, phrase, we need to find the cause and understand why it's erratic. Is it erratic because, some people's blood sugars go up in exercise. Some people's blood sugars go up because of fruit, and certain fruit might push your blood sugars higher. So you really need to get to know your body and get to know why the erratic blood sugars are happening. If we're usually, if you're getting erratic blood sugars, this may be someone who is diabetic. They're monitoring it. That's why they know it's erratic, because if we're not monitoring it, how would we actually know? So the question, I guess, positions the person, or that person who's experiencing erratic blood sugars as potentially diabetic. Is it the food choices that are being made? Is it the fact that, high fiber foods that allow the slow release of glucose isn't being consumed? And I think hidden sugars is really one of these things we need to educate ourselves in. Before I came in, I looked at the sauces in the cupboard, and there was this barbecue sauce, and I looked at it, and the first ingredient was high glucose fructose syrup, and I was like, how did this get into my house? So hidden things like that, you know, you know, I wouldn't expect it to be the first ingredient, and that means it's the majority of that substance is that sugar group. So all types of sugars. And what does that mean, erratic? As I said, the body responds to the sugar level. So if your sugars are high and the body then matches that with insulin, and the rate of the sugar absorption is fast. So let's say white bread or can of Pepsi Cola or something, or like a sugary drink, like Fanta, or one of these, energy drinks that people consume. So that would release sugar into the bloodstream very quickly, which means your beta cells have to produce insulin very quickly. That means that your insulin will start acting very quickly and potentially overshoot the amount of insulin required, and therefore then that would drop your sugars from high down to low. So these swings, high to low, and trying to find out why your sugars are swinging, I think it would take a consultation with a dietitian to actually look at your diet. And usually a diabetic clinics should have dietitians in them. Um, Taking responsibility of keeping a food diary, um, and writing down which foods push your sugars up very high and which foods don't affect your sugars too much. So keeping a food diary for 2 weeks might be helpful. Um, and then armed with that information, you can have a evidence-based discussion on really what's causing it. And I would say again, look at introducing higher fiber foods into the diet, and yeah, that would allow slow release of sugars. So in that's my answer. In summary, erratic blood sugars may be caused by diet. It may be caused by mismatch of medication to your glucose, um, and it's a complex problem. And the advice would be to discuss it with the diabetic dietitian and potentially get some help from your diabetic doctor. And if you don't have diabetes but have these high low sugars, speaking to your GP about it and getting investigated for diabetes.
Okay, thank you. Very comprehensive answer, and hopefully that does help with your query, Mary. We have got a couple more questions. We have got time, so if people want to put them in the chat or they can vocalize them, more than happy to take them. But we just wanted to pause for a moment to really thank you all for coming on, and also to say that we have a special gift, which hopefully week on week we'll be able to make a special gift to somebody on the line. We have available this week, we're talking about diet, and we're talking about the impact of what we're eating, on how this affects our diabetes in terms of stopping or helping to reverse perhaps. And we have got this book which is called, trying to get this on the camera, How Not to Die Cookbook. Now it is, I'm reliably informed, an excellent cookbook which is going to give a lot of information on preparing healthy meals that will encourage our bodies to function in the way that our bodies should function. So there are recipes here from everything, wonderfully colored. I don't know if you can all see this. I'm not making everybody jealous because we've actually only got one of these to give away today. But it's wonderful, wonderful cookbook. It talks about the various diseases that we might encounter in modern society. So everything from, talks about type 2 diabetes, infections, digestive cancers, Alzheimer's, lung diseases, kidney diseases, blood cancers, all of the things that could be affected by our diet. And this cookbook is a way to try and help us prevent them. So we did a draw a little bit earlier on while the presentation was going on. And we're happy to say that this evening's winner of How Not to Die is actually Nazia Sulman. So Nazia, thank you for coming online. This cookbook is yours. So if you would like to drop me a line in the chat with either your telephone number or your address or some way of contacting you, and we will ensure that this cookbook finds its way to you this week. Okay, so thank you for coming on, and this will definitely be getting to you. Now, before anybody gets too jealous or starts throwing stones at me over the screen, we will be having another giveaway next week. I'm not going to tell you what that is, but it will be another wonderful giveaway next week. So please tune into next week's session, and you too might be in for a draw for a wonderful prize. So Nazia, again, if you want to contact me, I'm on the personal line on the chat, and we'll make sure this gets to you. So quick commercial break there. We've got another question, Kevin, if you're still okay for them.
Yeah, that's fine.
We've got, could you say more on how the reversal diet helps in the long term? So is there anything else you can, I know we said to contact the GP, but is there anything more, any more information you can give us on that in the short term for the long term?
Yeah, it's interesting. It's all about maintenance, I think, when we talk about long term. And the question hints to the fact that short-term data might be excellent, but long-term data might be poor, and that's because bad habits creep back in. But what we do know is that the metabolic effect of weight loss is equivalent regardless of the method of the weight loss. So there was also another study which compared people who had bariatric surgery to lose weight versus people who lost weight through diet and exercise, and usually on a calorie restrictive diet. Now, they did it at 4 months, and they matched the weight loss to the metabolic behavior of the patients. So the weight loss difference. So people who were roughly, pardon me, people who lost the same amount of weight were matched together, let's say. So they nullified the weight loss being an issue by matching all the patients. So then once the patients were matched by sex, age, initial weight, and weight loss, in the two groups, surgery versus natural weight loss, um, and their their biochemistry was tested, i.e., how they handled sugar was tested, the outcome showed no difference. So what they concluded was that the weight loss was the treatment. The weight loss was the thing that caused the difference, not the method of weight loss, because the methods were different, but the weight loss was the same. So the weight loss caused the difference. So if we look at that question slightly differently, what can we do to maintain the weight loss that we've gained by going on such a restrictive diet? That's really the question. And if we look at the long-term data from bariatric surgery, we know that patients usually put on 10% of the weight that they've lost. Um, and so I tell my patients in the obesity service, if you want to be 11 stone, aim for 9 stone. So that when the weight comes back on, you'll settle off at 11 stone. And it's actually understanding the mechanics of the body and what will happen over time. So if we are realistic, the realistic answer is whatever diet we do, whatever, if we go down the route of surgery, whatever we do, it's likely that in the long term, the weight, which we know is the problem, may come back on. And therefore, in order to maintain the benefits long term, we have to maintain the weight loss long term. And so then the question becomes, how can I maintain a healthy weight? What can I do to maintain a healthy weight? And it's being honest with yourself. Um, you know, how much time do I get to go exercising an hour a day, every day, 7 days a week? How do I actually do that? That's the first question. I can put my hands up. I'm not achieving that at the moment. And it's something that we all probably, especially with this COVID period, should try to aim for. Am I actually doing that 1 hour a day? Am I eating mainly 2 meals a day with high fiber foods, no man-made, no processed, no refined sugars? Have I actually done that? And I've got to put my hand up again. Probably not. And so it's just a self-inspection of your lifestyle and actually being, strict with yourself. You're going to commit to achieving the weight loss. Now, going on to the 800 calorie diet, that obviously is not sustainable. Okay, that was done as it showed in the study over 4 to 5 months. So that was a short-term intervention to get the weight loss off, the weight off, bang. And some people lost up to 3 stone in weight.
Wow.
Okay, over that 4 to 5 month period, they lost 3 stone, let's say. So once they started to introduce food and the weight started to go back on, the treatment intervention became, how do you stop the weight going back on and how do you maintain your healthy weight? Some people increase their activity. Some people, instead of walking, maybe started cycling up to certain distances. I've got a patient who completely reversed his cholesterol naturally, and I was like, what did you do? He said, oh, I took up cycling. I cycle 70 kilometers a week now, regularly, 70 kilometers a week. So that just shows in our life, we're probably not doing enough exercise, as if we're honest with ourselves. And obviously, if we're overweight, we have to take care of what type of exercise we do. Non-weight bearing exercises, swimming, cycling, these tend to be better. But walking, if there's a weight bearing exercise that we all possibly should try to do, is walking. So, um, you know, that's really it. So it's not necessarily about maintaining an impossible diet for the rest of your life. No, that diet was an intervention or a bridge to weight loss. um, and so if we don't want to do it that dramatically, and to be honest, dramatic weight loss is not necessarily healthy either. This was a proof of concept, or weighing up the risk between worsening diabetes, which I showed you could be quite, you know, have many complications, versus rapid weight loss. So there's risk to rapid weight loss as well. But if you weigh up those risks in that patient, it may be that, you know, the rapid weight loss was less risky, and therefore the intervention was, a good choice. But for the majority of us who are trying to prevent the onset of these chronic long-term diseases, slow and steady wins the race. It may be, again, looking at your diet, and like for me, getting rid of that, that sauce that's in the house, never buying it again, you know, choosing healthier foods, apples, with slow release sugars, cutting out fruit juices, drinking mainly water, and just slowly looking at our life, asking ourselves, examine ourselves to see whether we are in health, and as it essentially comes down to that.
Excellent. Thank you, Kevin, and hopefully that's a good answer to the question there. I think one thing that's coming across to me is that this isn't just about a short-term thing. This
No.
is about lifestyle changes for
Mm,
the long term,
mm.
and perhaps not to be so hung up on these very short, sharp shock kind of treatments. What can we do step by step to sustain these changes? Excellent. Okay, we've got a couple more questions. We've still got a little bit of time.
And sorry, just to add to that, and because of that, you ask yourself the question, can I do this for the rest of my life? And
Mm,
if you know it's something good to do, but your commitment is lacking, you have to start to challenge yourself. And for me, let's say for me, I think inactivity for me is one of the biggest ones in my life. So it's starting to challenge myself, be active every day, 1 hour of walking every day, and just having that personal challenge. And it has to be something we can do for the rest of our lives.
And would you say we've said about the okay, guidelines are half an hour. You're suggesting, doctor, is to go to 1 hour.
Mhm.
Is it still worthwhile someone just starting with 20 minutes or
Yes.
40 minutes? It's not just unless it's an hour, it's not worth it. Am I hearing this right? That something is better than nothing.
Yeah, so that's very good, Gary. Thanks for that. I mean, there's studies showing that
Mm,
even 10 minutes versus people who are inactive, that 10 minutes was also very protective as well. So the ideal is an hour, but just starting, even if it's 5 to 10 minutes. And I say to people, my patients, 10 minutes, that's 5 minutes down the road and 5 minutes back. You
mm,
know, that's essentially the same time it takes just to turn around. It's
mm,
not that onerous. It's just committing to going out for that 10 minutes and then increasing slowly, 15, 20, 25. And as you increase, you'll find that your health, your exercise tolerance, it improves and you feel better for it. And so yes, you're right, start small and build up, but start.
Excellent. And just an appeal to those on the line. We are looking as an organization, Inspired Steps, at what else we can do with these sessions. We would have loved to do these sessions directly face to face, but obviously we're in the world of less contact. So we're going to be trying to do more contact on content online and over Zoom. First of all, next week's session is actually about weight management. How can we safely reduce weight? How can we keep that weight maintained? So an appeal to everybody on the line and anybody else you might think might be interested, please come and join us next week from 7 o'clock. We are also looking at doing some online fitness classes, online exercise classes. And we know that once there is other people doing something with us, most of us are more easily motivated and perhaps will maintain it when other people are doing a similar thing as us at the same time. So it probably will happen now in the new year. God willing, that after the break, we'll be starting to look at some Zoom fitness classes that we can join in together. So, be prepared for that. And the other thing I would say is that if anyone's got any suggestions on any health tips, any sessions, any programs that you would like to know more about, then please again include them in the chat and we will see whether we can be putting on more sessions. There might be issues that we haven't covered that are pertinent to you or those around you. So please include those in the chat and we'll do what we can over the next few months to try and get them going. So a couple more questions. We've got another one which says, would one meal a day help reverse type 2 diabetes?
So again, as the study showed, they did it based on an 800 calorie diet. Um, and that 800 calorie was divided up into, three sachets of drinks. So one approach would be, yes, one meal a day, um, but that meal should be breakfast essentially. There's this intermittent fasting as well, eating within a narrow window, and that seems to work quite well for weight loss. I've had a patient lose 3 stone on intermittent fasting, just eating between the hours, I think it was 8 and 2, a 6 hour window, and nothing after that, and nothing, no snacks, nothing, just 8 to 2. Um, the key message, I guess, is about calories, isn't it? It's not necessarily, but there are good calories and bad calories. So let's not go there. But what I'm saying is, if we pick the right foods, high fiber fruits and vegetables, reducing or opting for a plant-based diet preferentially, because you know only meat has cholesterol and that type of fat. Plants have sterol, so it doesn't have cholesterol per se. So going towards a more plant-based diet, I say to my patients, even if you reduce your meat days, I've got patients that eat 7 days meat 7 days a week, and just to get them to go down, just to start, like we said, one step, going down to, you know, 5 days a week meat, and then 2 days no meat, that's also a win.
Mm.
So I would say one meal a day, if you can stick to it, is very good. Well, yes, because the purpose is weight loss, and as I said, 2,500 calories for men a day, women, 2,000 calories. So usually we might advise going down to 1,500 calories for men, 1,200 calories for women. And if you think about a meal being 400 calories, you can still get 3 meals in with the 400 calories. And, 400 calories, that's 3 meals, that's 1,200 calories. So, the key thing is, can you do this for the rest of your life? And
Mm.
if you know it's about calorie restriction, it's not necessarily building that into just one meal, even though if you eat one meal you're and nothing else, you are by default restricting your calories that way. So that is an approach to restricting your calories. But you could also take the approach to divide your calorie portion into 2 meals, 3 meals. I 2 meals is probably what I would say is better. Um, so right in the middle, not one and not three. 2 meals tends to be sustainable, and then 2 meals at 500 calories each, tends to be quite filling. Um, so, but yes, the principle is calorie restriction and exercise, exercise, exercise. So if you find it hard to control your calories, eating 2 meals or 3 meals a day, yes, choosing one meal a day is an option. However, you could also split the calories between your meals and, come up to a total of 1,200 calories for women, 1,500 calories for men. Maintain that every 3,500 calories less that you consume, you lose 1 pound in weight. So therefore, over time, that would, add to you losing 1 to 2 pounds a month. So yes, the thing about the whole session is to give principles, but
Mm.
not necessarily to give commandments or directives that people must follow. And hopefully that answer gave some principles. It's about the calories that you take, choosing healthy foods with healthy calories, but choosing personally how you divide them up.
Okay, excellent. Okay, we've got a time just for a couple more questions. We've got another one that says the FIASP, is it insulin? FIASP FIASP insulin, how does that work out better than the other insulin? So that sounds like a very specific
I
type of
know.
medication. I don't
So
know if you're
I
aware of
don't
that.
know if I know that one. So I'm just having a quick look to see. Um, okay. It's a fast acting insulin. Um, so it's potentially, this is saying it's potentially better than Nova Rapid. So now that I know what it is, I can talk about it. So essentially, when we eat glucose, you remember I said it goes into the beta cell and then insulin is released in the proportion of the glucose that we've eaten. So if that mechanism is not there and someone is taking insulin, there are two types of insulin. There's the insulin that's the slow release, and we usually call that the baseline insulin. And naturally, our bodies are always releasing insulin at a very low level to keep everything in balance. And when we eat and the body senses food, then it would do a peak to match what we've eaten. Pardon me. In in persons on insulin, how we do that is we give them a slow acting insulin. Usually they might take this at night, and that would last for 24 hours. They're in the background. And then if they eat meals, every time they eat a meal, they should take the fast acting insulin. So FIASP is a fast acting insulin that you would take with meals. Now, I don't particularly know if it's better than Novorapid. So Novorapid is another type of fast acting insulin. So to answer that question, I would have to look at the literature, look at the experience of my colleagues in diabetes. So I can't actually say if it's better or not. But for detailed questions like that, I'll refer you back to the diabetic specialist who's prescribing those drugs. But um, again, sometimes these things, you find the right one that works for you. And if Novorapid wasn't working, then you potentially can suggest that to your doctor. You would like to try this new one and have a discussion.
Okay. Okay. So a couple more questions just before we close. We've got a couple more minutes. I'm seeing one about carbs, and I know I've heard it myself. A lot of people on these diets and say they've got to lose carbs or no carbs or carbs are bad. Is that right? So someone's asking the question, Mary's asking the question, what if you're carb counting? Okay. And following on from that, I know this isn't all about diet, but how many carbs should we be eating?
Yeah, so it's interesting. If you take away the carbs, you have to get the energy from somewhere else. And you tend to get the energy from protein and fats. Now, fats, you get 1 gram of fat is equal to 9 calories. And so um, you have to be cognizant that if you're reducing your carbs, you're eating either a high fat diet or a high protein diet. And both high fat and high protein have negative impacts on the body as well. High protein can affect the kidneys and cause kidney damage. High fats can clog the arteries and lead to more heart attacks and stroke. So you find that the high fiber foods, even though they're in the class of carbohydrates, because they're slow release and it leads to the sugars releasing from the beta cells very slowly and smoothly, then they actually tend to be, healthier. You know, we find that fruits and vegetables in a balanced way tends to be healthier than a high protein or a high fat diet. So if we go for a ketogenic diet, and maybe the person doing weight loss next week will touch on these things, um, you know, you have persons who are eating high fat foods, and it pushes your cholesterol very high. And therefore, to maintain, say, an Atkins diet or keto diet for a long period of time, you're actually weighing up weight loss versus, you know, problems with your health in the future. So, personally, I wouldn't recommend a low carb a low carb diet. I would recommend a right carb diet. If we choose the right carbs, we have, small pieces of sweet potato instead of English potato. We have, different type of pulses. So say brown rice versus white rice. If we choose to have, you know, the the right food. So, carrots and broccoli and beans and vegetable, I don't have to list them all. I think, we all know what I'm talking about. If we choose the right ones, and we eat the right volume, because we can eat too much of a good thing as well. Going back for seconds is potentially something we need to conquer as well. They say take a handful of nuts a day, and I'd show me a person who can eat a handful of nuts, and I'll give them a reward, because what you find is that you tend to eat more than that. And so really looking at portion control, um, really, the good food choices, that's one, but then the right amount, or the right portion for that. And you'll be surprised how little a portion is, um, you know, and it's just committing to agreeing with yourself that that portion is enough for me. I will not go back for any more. And so I would say, um, the right carb diet in the right portion with, exercise daily, as much as you can tolerate, in terms of up to an hour. But if you can't do an hour, building up to that, that should stand us all in good stead. Um,
Excellent. Okay, thank you. And time's nearly out now, but we've got time for one last question. And Nazia is asking if somebody is borderline diabetic.
yeah.
Okay, I know that we've talked about diet and we've talked about exercise, but if someone is borderline diabetic, is there anything else that they should be doing specifically?
Yeah, it's a very good question. As people, as humans, we tend to wait until things are in an emergency situation to try to do something about it. So diabetic, and then we really lock onto the lifestyle, or, pre-diabetic warning, and we say, right, I need to do something about this now. And getting into that place where we just do it because it's right, it's a hard thing to do as humans. We For some reason we wait until the writing's on the wall to then try to do things about it. But pre-diabetes is, a warning, yes, but it's a good warning to have, because then you can do something about it. And what can you do? I mean, it's, as we said, the key thing is exercise, exercise, exercise. Be honest with yourself. If you're not exercised daily for the past 5, 6 years, and now you're pre-diabetic, then, it's because I haven't exercised daily for the past 5 to 6 years. Let me do that. Exercise daily going forward. It's about choosing again the fiber foods, the high fiber foods, slow release sugars, avoiding anything that's harmful. And by that I mean any refined sugar. So, avoiding biscuits, crisps, chocolates, avoiding even honey, in certain situations. You don't want to overuse even the good things. Um, you know, Getting rid of fruit juices, um, getting rid of breads potentially. Um, you know, you have to be very strict with yourself, um, and just eat the right amounts of fruits and vegetables, going forward. And hopefully, the cookbook will help, give you ideas for different times of the day. Um, Water, very good. Sunlight, fresh air, sleep, again, really, really important. But I believe the two major things in our lives are hidden sugars, so becoming knowledgeable in that, which foods to avoid, and lack of exercise. If we do, you know, the right amount of exercise, up to an hour a day, we eat the right foods, and we get enough sleep, that in itself should be powerful to reversing the pre-diabetic state. But weight loss, weight loss, weight loss, especially around the abdomen, um, that's where the metabolically active fat sits around the abdomen. So if we can get rid of that, that would stand you in good stead. So diet, exercise, weight loss, sleep, water, fresh air, um, vitamin D. We didn't talk about vitamin D tonight, but that's very, very crucial. And as we've been in lockdown twice this year, and if we have darker skin, we're not getting any vitamin D naturally. So considering taking a vitamin D supplement or eating foods high in vitamin D, that's also really important as well. Um, so yes, those would be the things that I would suggest. It's what we kept seeing in the presentation over and over again: running, the diet, the right diet, sleeping, and weight loss. And hopefully that's helped, Nazia. It's in the doing. As you do it, you'll get to know it, and as you know it, it will become your reality.
Excellent. Okay. I've said last question, but there is very, very last one. Someone, Andrew is asking, is switching to coconut oil a good idea?
So say that again.
Is
Is
switching to coconut oil, I'm assuming for cooking purposes,
mm,
switching to coconut oil a good idea?
again, personally, I'm not sure. Let me say that. I'm not sure. I've not actually looked into coconut oil. Some people may say it's more stable, but the key thing to understand is this: all oils, from olive oil, coconut oil, sunflower oil, if it has the word oil in it, all oils are fats, and all fats increase. 1 gram of fat is 9 calories. Okay, so you have to be very careful with oils. We get a green salad and we pour lots of oils on top, or we might want to be, if we're using coconut oil to prepare a healthier meal, we might put too much in, and then it becomes unhealthy. Someone says, a jacket potato is only 140 calories, but then we put butter on it, push it up to 250, 300 calories, and in and of itself, it's only, 1/2 of a gram of fat, but with the butter, it now becomes 12 grams of fat. So we have to be really careful with oils. Oils is just like hidden sugars. Um, they can be things that you don't realize and it doesn't register, that's causing you to gain weight. So I would say do your research, look at how it affects your calorie content, and make the decision, yourself, because you know you just need to be careful with oils in general. And that's where I'll stop.
Okay. Thank you so much, Kevin, for not only an excellent presentation, really well researched, really well presented, but answering so many questions in a way that I'm sure have given so much of us not only food for thought, but hopefully things that we can actually act on. Because if there's certainly one thing that I'm taking away from this, is that we've got the information, but it's in the doing now. We need to practically apply some of these steps. And the thing that most strikes me about a lot of this information is that it is doable. It is doable. We can take more exercise. We can consider what we're eating. We can drink more water. We can get out in the sunshine. Yes, we're challenging the way that we've lived for a long time, but definitely we can do this stuff. So let's apply it. So thank you very much, Dr. Kevin. We know that you are very busy, as I'm sure everybody is in your profession at the moment. So we really do thank you for taking the time to come and share with us. Again, another plug, Nazia, don't forget to get in contact with me. Just drop me a line privately, or I'll leave my phone number in the chat. But please do get in contact, give us your details and your address, and we'll make sure this book gets to you. Anybody else who wants another gift, then please come to us next week. Can I share next week's presentations? Let's have a look. Next week we have, bear with me, Okay, if we can all see that. So we've got 2 more sessions in this series, but we are also going to be looking to squeeze in our COVID-19 immune system protection session, which should have been last week. So next week's session is about managing your weight between 7 and 8:30 again. Rachel Hanley will be delivering that. She is a health practitioner who is in Brazil. So we'll be getting an international flavor next week, managing your weight. And then the following week, we're going to be looking at stopping smoking, which should also, I believe, be looking at vaping, this vaping that's obviously very large at the moment. So managing your weight, stopping smoking, and then we will also be finding a way to be getting on board our COVID-19 and boosting our immune system session. So thank you very much. If there's any comments, questions, we're getting a lot of feedback. Kevin, great presentation. Thanks for your inputs from those in the chat. Anybody would like to ask for any future presentations or things that we might want to think about, please include them in the chat. And once again, thank you for spending the time with us this evening. Hopefully it's been a blessing and beneficial to you all, and all being well, we will see you again next Thursday evening. Okay, take care then.